superior vena cava. This is inferior vena cava. It's going to come into right atria. From the right atria, can't get it off now. Right atria flows through the tricuspid valve into the right ventricle. From the right ventricle up through the pulmonary semilunar valve into the pulmonary trunk. Pulmonary trunk splits into left and right pulmonary arteries. They're arteries because they're carrying blood away from the heart. They're blue in this instance because in this instance they're not oxygenated blood. All other arteries will be red. These are blue, again, because they're going to the lungs to get oxygen. Coming back from the lungs, pulmonary veins. In this instance, they're red. All other veins are going to be blue. Pulmonary veins bring the blood here back into the left atrium. From the left atrium, goes through the mitral or bicuspid valve, which is falling out of the sky right at the moment, and goes into the left ventricle. From the left ventricle up through the aortic semilunar valve, that's the white valve that's in here, and that, like right in there, up through the aortic arch. Aortic arch, three main branches in the human. First one is the brachiocephalic artery. The next one here is the left common carotid, and then the left subclavian. On those other hearts where they go up a little bit higher, it's going to show where the brachiocephalic splits into first the right carotid and also the right subclavian. So on the other hearts that go up a little bit higher, you're going to see the brachiocephalic splitting. Okay? Blood flow through the heart. All right, if we're talking about muscles in the heart, the muscle ridges that you see in the atria are pectinate muscles. The big ridges that you see in the ventricle are trabeculae carnae. The strings coming down from the valves are chordae tendineae, and the mounds of muscle that the chordae tendineae attach to are papillary muscle. This whole big part of the muscle of the heart, myocardium, surface of the heart, visceral pericardium, surface inside the ventricle and the atrium, endocardium. Split between ventricles is the ventricular septum. I don't know if we talked about this with your class yet. The little white piece, the little white connective piece between the arch and the trunk, right here, is ligamentum arteriosum. Make sure I mention that to the big group. We have it. Splits here, the gap between the atrium and the ventricle are sulcus, either right or left, depending on which side you're on. Running through those on either side are the right or left coronary arteries. You can also see those right here and right here. You can also see the left one right here, and you can see them right here and right here. So this artery running down the front of the heart here is the anterior interventricular artery, and it's coming off of the left coronary artery. A coronary artery gives you here on the back circumflex artery. If you follow the right coronary artery, along the right edge down here is the marginal artery, and around to the back is the posterior interventricular artery. For the veins, down the middle of the front, great cardiac veins. Running right here on the right side with the marginal artery are the small cardiac veins. And running right down the middle of the back are the middle cardiac veins. Where all of those drain into, right here, is the coronary sinus. That should get you guys